Welcome to our comprehensive exploration of heart attacks, a crucial health topic that demands our attention and understanding. In the next few minutes, we'll embark on an extensive journey into the intricate world of cardiovascular health, diving deep into the multifaceted nature of this life-threatening event. The consequences of a heart attack can be devastating, ranging from permanent heart damage to sudden cardiac arrest and even death. Let's unravel the mysteries of heart attack. 1. Definition and overview. A heart attack, also medically termed as a myocardial infarction, MI, is a critical and life-threatening event characterized by the sudden interruption of blood flow to a segment of the heart muscle. This interruption results in the deprivation of oxygen and essential nutrients, ultimately leading to irreversible tissue damage or death. Recognizing the severity and urgency of a heart attack is crucial for prompt intervention and optimizing patient outcomes. 2. Epidemiology. Heart attacks are a prevalent and leading cause of mortality globally, contributing to millions of deaths each year. Despite significant advancements in medical research and treatment modalities, the incidence of heart attacks continues to pose a substantial burden on healthcare systems and communities worldwide. Understanding the epidemiology of heart attacks is essential for implementing effective preventive strategies and improving public health outcomes. 3. Pathophysiology. The pathophysiological mechanisms underlying a heart attack are complex and multifaceted. It typically begins with the progressive accumulation of atherosclerotic plaques within the coronary arteries, leading to the narrowing or occlusion of these vessels. Subsequent plaque rupture or erosion can trigger the formation of a blood clot, resulting in the sudden obstruction of blood flow to the heart muscle and subsequent myocardial ischemia and necrosis. Delving into the intricate pathophysiological pathways involved in heart attacks is crucial for elucidating potential therapeutic targets and optimizing treatment strategies. 4. Risk factors. Heart attacks can be influenced by a myriad of risk factors, which can be broadly categorized into modifiable and non-modifiable factors. Modifiable risk factors encompass lifestyle choices such as smoking, unhealthy diet, physical inactivity, obesity, and chronic stress, all of which can significantly increase the likelihood of developing cardiovascular disease and experiencing a heart attack. On the other hand, non-modifiable risk factors include genetic predispositions, age, gender, and family history, which contribute to an individual's inherent susceptibility to heart attacks. Recognizing and addressing these risk factors are paramount for implementing targeted preventive interventions and reducing the global burden of heart attacks. 5. Symptoms. Prompt recognition and understanding of the symptoms associated with a heart attack are essential for timely diagnosis and intervention. While chest pain or discomfort is the hallmark symptom of a heart attack, other common manifestations include shortness of breath, nausea, vomiting, sweating, lightheadedness, and pain or discomfort radiating to the arms, back, neck, jaw, or stomach. However, it is important to note that symptoms can vary widely among individuals, and some may experience atypical or subtle signs, emphasizing the need for heightened awareness and vigilance. 6. Diagnosis. Accurate and timely diagnosis of a heart attack is paramount for initiating appropriate treatment and optimizing patient outcomes. Diagnosis typically involves a comprehensive evaluation, including a detailed medical history review, thorough physical examination, electrocardiography, ECG, EKG, blood tests for cardiac biomarkers, troponin levels, echocardiography and coronary angiography to assess coronary artery patency and identify the presence of obstructive lesions. Understanding the diagnostic modalities and criteria employed in the evaluation of heart attacks is essential for healthcare providers to effectively triage and manage patients presenting with suspected acute coronary syndromes. 7. Emergency management. Immediate and effective management of a heart attack is critical for minimizing myocardial damage and improving patient survival. Emergency interventions aim to restore blood flow to the ischemic myocardium and alleviate symptoms. These interventions may include administering aspirin to inhibit platelet aggregation, providing supplemental oxygen to improve tissue oxygenation, administering nitroglycerin to dilate coronary arteries and reduce cardiac workload, and administering pain medications to alleviate discomfort. In cases of ST segment elevation myocardial infarction, STEMI, reperfusion therapy with thrombolytics or primary percutaneous coronary intervention, PCI, is initiated promptly to restore coronary blood flow and salvage ischemic myocardium. Additionally, close hemodynamic monitoring and supportive care are essential for optimizing patient outcomes during the acute phase of a heart attack. 8. Medical interventions. Following stabilization, patients with heart attacks may require further medical interventions to reduce the risk of recurrent events and improve long-term prognosis. These interventions may include pharmacological therapies aimed at inhibiting platelet aggregation, reducing cardiac workload, and improving cardiac function. Common medications prescribed post-heart attack include antiplatelet agents, for example, aspirin, clopidogrel, beta blockers, for example, metoprolol, carvedilol, angiotensin-converting enzyme, ACE inhibitors, for example, lisinopril, enalapril, statins, for example, atorvastatin, rosuvastatin, and aldosterone antagonists, for example, spironolactone. Additionally, lifestyle modifications such as smoking cessation, adoption of a heart-healthy diet, regular physical activity, weight management, and stress reduction are emphasized to optimize cardiovascular health and reduce the risk of recurrent cardiovascular events. 9. Complications. Despite optimal management, heart attacks can lead to various complications, which may significantly impact patient outcomes and quality of life. Common complications include arrhythmias, heart failure, cardiogenic shock, mechanical complications, for example, ventricular rupture, papillary muscle rupture, thromboembolic events, for example, stroke, pulmonary embolism, and psychological sequelae, for example, anxiety depression. The identification and management of these complications require a multidisciplinary approach and close collaboration between healthcare providers across various specialties, including cardiology, critical care, electrophysiology, and rehabilitation. 10. Rehabilitation and recovery. Cardiac rehabilitation plays a pivotal role in the recovery and long-term management of patients following a heart attack. Cardiac rehabilitation programs are comprehensive, multidisciplinary programs that aim to optimize physical, psychological, and social recovery while promoting secondary prevention and enhancing overall quality of life. These programs typically include supervised exercise training, patient education, nutritional counseling, smoking cessation support, psychosocial support, and risk factor modification. By participating in cardiac rehabilitation, patients can improve cardiovascular fitness, reduce disability, prevent recurrent events, and enhance their overall well-being. 11. Long-term management. Long-term management of heart attack survivors focuses on maintaining cardiovascular health, preventing recurrent events, and optimizing overall quality of life. This involves ongoing medical supervision, regular follow-up visits with healthcare providers, medication adherence, lifestyle modification, and risk factor control. Healthcare providers work collaboratively with patients to develop personalized management plans tailored to their specific needs and goals. Emphasis is placed on maintaining a heart-healthy lifestyle, adhering to prescribed medications, monitoring and controlling cardiovascular risk factors, for example, hypertension, hyperlipidemia, diabetes, and seeking prompt medical attention for any new or concerning symptoms. Additionally, patient education and empowerment play a crucial role in fostering self-management skills and promoting active participation in one's healthcare journey. 12. Prevention. Prevention is paramount in reducing the incidence and impact of heart attacks. Preventive strategies encompass primary prevention measures aimed at reducing the risk of initial cardiovascular events and secondary prevention measures aimed at preventing recurrent events and optimizing cardiovascular health in individuals with established cardiovascular disease. Primary prevention strategies include lifestyle modification, for example, smoking cessation, adoption of a heart-healthy diet, regular physical activity, weight management, stress reduction, optimization of cardiovascular risk factors, for example, blood pressure control, lipid management, glycemic control, and targeted pharmacotherapy, for example, aspirin, statins, in high-risk individuals. Secondary prevention strategies focus on comprehensive risk factor management, adherence to prescribed medications, participation in cardiac rehabilitation, and ongoing medical supervision to prevent recurrent events and optimize long-term outcomes. By implementing a multifaceted approach to prevention, healthcare providers can significantly reduce the global burden of heart attacks and improve cardiovascular health outcomes for individuals and communities. 13. Education and awareness. Increasing public awareness and education about heart attacks, risk factors, symptoms, and preventive measures is essential for empowering individuals to make informed decisions about their cardiovascular health. Educational initiatives should target diverse populations across different age groups, socioeconomic backgrounds, and cultural contexts to ensure widespread dissemination of accurate and actionable information. Key components of education and awareness campaigns include community outreach programs, public health campaigns, school-based education programs, workplace wellness initiatives, and healthcare provider training. By raising awareness and promoting early detection and intervention, we can empower individuals to take proactive steps towards reducing their risk of heart attacks and improving their overall cardiovascular health. In conclusion, heart attacks represent a significant global health challenge with far-reaching implications for individuals, families, and communities worldwide. By fostering awareness, promoting prevention, enhancing emergency response, advancing medical care, and investing in research and innovation, we can collectively strive towards reducing the incidence and impact of heart attacks and fostering a healthier future for all. Together, we can make meaningful strides towards improving cardiovascular health outcomes and enhancing the quality of life for individuals affected by heart attacks. For more informative content on health and wellness, subscribe to our channel and stay tuned for future updates. Take care of your heart and stay healthy.